welcome our 8th keynote speaker, Mr. Arun Kumar from Lepra.
Mr. Arun Kumar Kandukuri is a senior public health and development professional with over 2 decades of experience working with government agencies and international non-governmental organizations. He currently serves as head programs, resource mobilization, and communications at Lepra Society, India. Throughout his career, he has held key positions with the Central Leprosy Division under the Ministry of Health and Family Welfare, Government of India, and other leading public health organizations. Mr. Arun has led over 50 public and community health initiatives, authored 20 scientific abstracts, and contributed to national health communication campaigns, including leprosy awareness films featuring Shri Amitabh Bachchan.
Good evening, everybody. Firstly, I would like to I'm truly honored to be presenting at the CSR Summit. It's also a privilege for me to join the distinguished speakers, leaders, change makers, and also impact creators across India. And I would like to take this opportunity to thank Sri Aditya Garu and also Mahesh Garu of Infosys Foundation for giving us this opportunity to present about our journey. And also I'd like to take this opportunity to thank CSR Summit organizing team for their relentless meticulous planning and also particularly with respect to the supporting us to present this. Thank you very much. And today I'm going to present about neglected tropical diseases. These are neglected tropical diseases, not neglected because the diseases are rare, but these affected persons are more invisible. Every year, thousands of men, women, and children are affected because of the disease. And this case study, basically, I would like to take you through the Pavitra journey. Basically, he's a 12-year-old child living in remote village of the Koraput, Odisha state. Basically, he was laughing and going to the school and dreaming big for his future. Suddenly, he hears the news that he has a leprosy. Then, his completely world changes. His parents are worried because he will not only lose he was diagnosed with respect to the multibacillary leprosy and also particularly with respect to his nerves in the hands have been damaged. Knowing this, his parents are worried he will not only lose his hands, not only hands but also education and also his future. And also they are more worried because of the stigma, because leprosy we have, they isolate the people. So their lepra has stepped in through the school awareness programs. We could detect Pavitra very early stages. They could do the counseling, physio care, and we could really give with respect to the aids and appliances. And constant counseling has helped him to regain his health. So now Pavitra has regained his old days, and particularly he is back into the school, learning again and dreaming big for his future. So why leprosy? Nowadays, I think most of the people know that it's a disease of the past. It is also said that it is about nearly more than 5,000 years ago disease, and still it's a challenge to the humankind. Still, it's a bacterial disease, but it is affecting many thousands and lakhs of people every year in India. And India constitutes about 60% of the cases are found in India, and 8 to 10%, it is little less, but at least, in actual estimations, it is more, are leprosy affected. We try to have the disabilities. And more particularly, we try to see that it's a completely preventable and avoidable disease. So if at all we try to see that with respect to the leprosy, it affects eye, hands, and health, and basically foot. The next disease is with respect to the neglected tropical disease is called lymphatic filariasis. It is caused by the mosquito. More than 120 million people affected in the globe, and we try to see about 40 million people in India. And yet to rightly see with respect to the photograph here, the legs will be swollen because of the bite of a mosquito. So these people need more sympathy, more dignity, and as well as we need to really restore their lives. And in India, we see that about nearly more than 355 districts are endemic for lymphatic filariasis. Regarding lepra, if at all I try to talk about, it's about 100-year-old organization. It has started in 1924. And basically since then, we are trying to work for the leprosy patients. And we could really have key activities which include the footwear, customized footwear supplied to the patients. And also we could really involve with respect to drug development and also pilot testing of the drug, initiation of the treatment. And also we also have the research facility called Blue Peter Research Center at Hyderabad, wherein which we carry out medical and health research related to the leprosy and lymphatic filariasis. And to build the evidence, we try to do the research, clinical, microbiological, medical research, we try to do it. And if at all we try to see, presently we are operating in 11 states, and we are trying to have in 110 locations we are operating. And these are the numbers, basically we just not really get into the details, but behind every number I see that there is a human being. So this is a continuum of the care. We just try to provide to the patients primary, secondary and tertiary care. Primary care includes mostly related to the awareness, door-to-door screening, and as well as particularly facilitating the treatment initiation. The secondary care in which we could really have in 26 locations, we try to provide ulcer care, physio care, and also particularly linking to the livelihood schemes, we try to have it. And on the tertiary care, we try to provide for the surgery. Leprosy people will get into the surgical needed reconstructive surgery, which could include basically claw hand or drop foot or lagoptomas with related to the eye conditions. So where in which we could try to facilitate in primary, secondary and tertiary cares. This is a comparative case study. Just I'm trying to say about Santosh. Healing ulcer is not only healing ulcer, basically it's about restoring life to someone. So people affected by leprosy lose the sensation in the basically foots, and they will not really have the sensation when the healing is little become serious. They will not have any sensation. And these ulcers are little complicated, requires a lot of efforts, healing these ulcers and restoring their dignity. Santosh is now happily working now, moving now, and doing his livelihood and supporting his family. And these are some of the numbers. I'll not really go into the details. This is about nearly 2 lakh odd people we could really touch in the last 1 year with respect to the physio care, ulcer care, and put on the initiation of the treatment. Again, there's also about lymphatic filariasis. There's also some of the key numbers we could really have it. I'll not go into the details, but we could really restore most of the people's lives and the dignity. I'd like to stress upon this slide, wherein which you try to see that whenever these people are affected, these affected with respect to the below poverty line people, and also they are disease affected. So they are most vulnerable to the livelihoods particularly. And seeing this need, they lose their employment. Because of that, we could really facilitate into 3 aspects. One is linking to the government support schemes. Second is we try to provide with soft loans to the individual businesses, to leprosy and lymphatic filariasis patients, wherein which they try to restore their dignity and start earning in their families. And third thing is with respect to the group support. As you rightly see with respect to the women, these are the women that are in Orissa state, in Puri, wherein which we could really mobilize these groups for the mushroom cultivation. We could have now groups, these are the groups are cultivating the mushrooms. So the last month only we could really have 500 kgs of mushroom cultivated by these leprosy patients and LF patients cultivating the mushrooms, and now they are the entrepreneurs. And these are some of the challenges we would like to have it, and we want to really going forward to take it to the next level. As delayed diagnosis causes the disability, we want to really introduce with respect to the teleconsultation and also using of the AI nowadays. It's a more buzzword now. We are trying to use for the foot measurement system for providing the customized footwear. So this innovation has been selected for the WHO Public Health Champion Award for the last year as a Southeast Asian region as a best innovation. And we also feel that more number of the disability clinics, now presently we are operating in almost 110 districts. Basically, there is a greater need to establish these comprehensive disability care centers for the leprosy and lymphatic filariasis. And also with the partnership of the CSR, we can enhance our services. Together, we can eliminate tropical diseases with your support. Thank you very much.
Thank you so much, sir, for these words. We've completely enlightened with all your information and knowledge.